Hi, I'm Dr. Brownfield, and I'm working at Grady Veterinary Hospital, and today we're going to talk about diabetes. So there are two different types of diabetes. One called diabetes insipidus, that is a problem with water regulation, and that one's fairly rare in our canine and feline patients. However, diabetes mellitus is the other type that's most common in dogs and cats, and that is a problem with blood sugar regulation. And that is broken down into two different types. Type 1 is an insulin-dependent type, and that is most common in dogs. And that is when the pancreas does not produce enough insulin, and the patient needs insulin injections in order to function properly and regulate their glucose. The second type is non-insulin dependent, and that occurs most commonly in middle-aged to older obese animals. And they produce insulin, but it may be an insufficient amount, or their body may actually be insulin resistant. And in those cases, they still usually need insulin injections. In people that are type 2 diabetics, sometimes we can manage them with oral hypoglycemic medications. However, our veterinary patients don't typically respond to that, so they still need insulin injections. So the signs that you should look for in your pet associated with diabetes include an increase in appetite but weight loss, an increase in thirst, and an increase in urination. And the reason that these things occur is because the body cannot properly take up glucose without enough insulin, and so your pet will start to break down their fats and protein, and that'll actually make them lose weight, but they feel like they're not getting enough nourishment, so they will actually eat more. And then when glucose builds up into the bloodstream instead of moving into the cells properly, the glucose will actually spill over into the urine as it's filtered out of the kidneys, and it takes water with it. Water is attracted to glucose, so it spills over with it, so we'll see an increase in urination. And your pet may try to compensate for that by drinking more, so we often see an increase in thirst as well. So in order for your veterinarian to diagnose diabetes, there are a couple of different things that they look for. One, we look for the associated clinical signs that your pet may have at home, and then we check a blood glucose, and we look for a persistently high or elevated blood glucose level. And it's normal for blood glucose to spike a little bit after a meal. However, it's usually not significant enough to cause blood sugar to be present in the urine. So we'll also look for blood glucose in the urine, and that tells us that it's remained high in the bloodstream and has actually started to spill over into the urine, and that can help us to diagnose. Treatment for diabetes is very important, and all diabetics need treatment. So the first line therapy of treatment is actually modification of the diet. And it's important to feed a diet that's a little higher in fiber and has less carbohydrates, which break down into sugar. And it's also very important to get your pet on a routine schedule for eating, like twice a day, instead of letting them feed all the time, because insulin needs to be given when your pet is eating. The other reason that that's important is so that we know that your pet is still eating and it's okay and safe to give insulin, because there are serious consequences to administering insulin in a pet that has not been eating. So that's the first line of therapy. The second line of therapy is actually administration of insulin. And a lot of times when your pet is first diagnosed with diabetes, they're usually kept in the hospital and tried to regulate that way by administering insulin until we bring down their blood sugar level to an appropriate level. A lot of owners are intimidated somewhat by having to give their pets insulin at home. So a lot of times it's very important to go over that it's a lot easier than we actually think that it is, and giving your pet these injections really doesn't hurt them. It's a very small needle, and it's important to know how to properly administer insulin as well. So what I always tell my patients or my clients is to actually keep your insulin in the refrigerator. You don't want to freeze it, and you don't want to leave it out. When it's in the fridge, it can actually settle out, so you want to make sure you mix it up appropriately, but you don't want to vigorously shake it. You want to roll it gently between your hands in order to mix it well without creating a bunch of foam or air bubbles. Because when you pull that up and there's air bubbles in there, we can inaccurately dose them. So we gently roll that between our hands, and then we turn the bottle upside down and actually insert the syringe into the bottle and pull up the amount that's needed. And then you just tent your pet's skin and insert it just under the top of the skin and squirt it in and remove the needle, and most pets don't even really feel it. So that is a lot easier than most people think, and pets can be managed very well by their owners at home. It's important to continue monitoring your pet at home even after the initial visit and regulation in order to make sure that we're maintaining good control of diabetes. So it's important to watch for an increase in thirst, increase in urination, and an increase in appetite or weight loss, just like we were seeing, before your pet was diagnosed. And that's important to continue to monitor because that can be the first sign that your pet may be slightly out of control of their diabetes and need to be rechecked. And it's also important that even when your pet is doing well and is eating and drinking and doing fine, to actually do routine rechecks with your vet just to make sure that all of the levels are appropriate. So the last important point to discuss about diabetes are the complications that we can see from administering insulin in our diabetic patients. And the biggest complication that I see as a veterinarian are patients that come in and their blood sugar is now actually too low. Signs of hypoglycemia or low blood sugar include weakness or your pet being very lethargic, maybe a drunken or wobbly gait, and then the biggest thing that we can see as well, if it gets too bad, are actually seizures or convulsions. And so if any of these things are noted, you should take your pet to your veterinarian immediately just to make sure that they're not too hypoglycemic. If that happens, then we may need to actually keep them here in the hospital until we can get their blood sugar back up into a normal level. So although it may seem somewhat scary to hear all the different signs and things that can go along with diabetes, diabetes is actually a very manageable disease in our patients and something that many owners find easy to treat at home. And as long as you work with a consulting veterinarian and you ask as many questions as you may have, then their prognosis can be really good. So if you have any questions or you're concerned that your pet may be affected by diabetes, then certainly don't hesitate to call your veterinarian and make an appointment.